we sometimes go to aesthetic clinics for a bit of an assistance
because many people, they've got the fixed sign 11.
People are worried of getting this come up overfilled look.
Patients who do want to go overseas for treatment have to be cognizant of certain things.
That's something else that you really have to prepare yourself, whether you are someone else that can take injections or not.
You should not be afraid of your doctors. They're not disciplined teachers. They won't get mad at you if something were to happen. Hello everyone, and welcome to Elogio Aesthetic Insights. Now today we are going to dive into a very interesting topic that will bring up so many questions, especially for those who might be interested in going for an aesthetic treatment. Injectable complications. Now, before we dive into it, I'd like to establish something very important. Now, when it comes to injectables, whether it is, for example, a wrinkle relaxer or a collagen stimulator, or perhaps something as simple as a skin booster, we must always remember that every single one comes with the potential of complication. Now, we're not trying to scare you here. Don't worry about it. Our goal is to empower you with knowledge. And more importantly, we want to move beyond the myth that perhaps a single type of filler or even a single type of brand are more prone to such issues. And we're going to talk about an open and honest conversation about what could go wrong, how to go about certain things and what to look out for. And more importantly, the information that you learn today, you are going to use it to make an informed decision for your next treatment or injector. But before we get started, let's welcome our prestigious panelists of doctors. Welcome. Hi.
Hi everyone, I'm Dr. Lam Bilang from Ageless Medical in Singapore, and I've been practicing aesthetic medicine for more than 20 years. I'm also a trainer for derma filler and botulinum toxin injections, both regionally and also globally.
I'm Dr. Stephanie Yang, an oculoplastic surgeon from Singapore and also the medical director of Eagle Aesthetics and Surgery. So I have a strong interest in surgical and non-surgical periorbital rejuvenation.
Hello everyone, I'm Dr. Kang Nien from Central Dermatology Specialist Clinic, and I'm also a consultant dermatologist who is based in Hospital Sultan Abdul Aziz Shah. My interest is more in dermatology and as well as dermatologic surgery.
Hi, I'm Dr. Edmond Lau, founder and medical director of Easy Skin Laser Clinic in Penang, and my interest is in medical aesthetic, and I treat skin conditions as well as making people more confident with their skin.
All right, thank you so much, doctors, for joining me today. I'm very excited because as a working mom, I've been incredibly busy and clearly neglecting my skincare duties. And you know what happens after that. Normally, whenever you have neglected that part of your life because you're focusing on perhaps your family or even your work, we sometimes go to aesthetic clinics for a bit of an assistance to help reverse the aging effect. Now, when it comes to doing that, it's very natural for each and every one of us who are about to embark in it to do a little bit of homework. And especially after seeing some less than ideal outcomes online, it's very important for us to understand a little bit more on what to expect and perhaps even a little bit more knowledge on what it is exactly. So to start off with, I'm going to ask Dr. Lam, do you mind sharing with me, or all of us for that matter, what are injectables and why have they become so popular?
Now, injectables, basically they are products that we inject into our skin to improve certain areas of concern. For example, you can use botulinum toxin injections to relax facial muscles, to improve your lines and wrinkles. You can use derma filler injections to fill wrinkles and to replace your volume loss, or even skin quality injectable to improve your skin quality. Why has it become so popular? Because many people, they've got the fixed sign 11 in between their eyebrows, which makes them look angry, makes them look unapproachable, and they will have crow's feet, which make them look aged, and they therefore want to have botulinum toxin injections to relax these facial muscles and improve the wrinkles on their faces. Or For mothers like yourself, you want a skin quality treatment so that your skin is more radiant, glowing, it's a sign of health and vitality, your makeup stays better, then obviously you want an injectable that can actually help you improve your skin quality. And that's the reason why it's become so popular these days.
Now, this is very, very interesting to be able to hear from that perspective, because I think it's also important for a lot of our audience, including myself, to understand as well. Let's ask this question to Dr. Edmond. What are some of the most common types of injectables that people ask for?
Well, as what Dr. Lam said, right, the common types are botulinum toxin, dermal fillers, biostimulators, and skin boosters. And in recent years, skin boosters and biostimulators demand has peaked because people are moving away. People are worried of getting this plump up, overfilled look that, some of them bring pictures of celebrities showing signs of being very puffy. So now people are demanding or wishing for a better skin quality, better skin health. And hence, I think with all the information available online, they are coming and demanding for skin boosters treatment as well as biostimulator treatment to make sure their skin stays safe, stay young and healthy.
Very, very interesting. Dr. Hao, can you explain what are the most frequent minor side effects people experience after these treatments? Because as what Dr. Edmond had said, naturally there's always a compare and contrast, and what they want to decide, if I want it to look a certain way, I want to look like a certain celebrity perhaps, and then the next thing you know, that celebrity's face. So do you mind explaining, Dr. Hao, the most frequent minor side effects?
I think if we're looking at the most frequent side effects, minor side effects that we're looking at, so as the name it is injectables. So when we talk about injectables, we're putting on a needle onto your skin. So the first thing is there will be pain. That's something else that everybody have to anticipate. And when we're looking at pain, some people tolerate it quite well, but some people who have needle phobia, they may just faint. So that's something else that you really have to prepare yourself, whether you are someone else that can take injections or not. And if you are someone else that can't, then we'll have some other ways to do it. For example, we do some local anesthesia and we do a little bit of a topical anesthesia. And this is also one of the sources that you will commonly get reactions to. You might get some itchiness, you might get some redness from there. Alright, so and the last one that I would like to highlight probably as the injectables, well, face is covered with all sorts of blood vessels. So one of the things that you are looking at is bruises. I think that's something else expected, and we have ways to treat it, but sometimes you have to, when you're going through injectables, I think you have to really look at getting yourself a little bit of a downtime. Yeah.
That's very good advice. And I think that's one of the things that people might not be aware of. It's the mental preparation of the injectable itself, the injection. Now, this is something that is also becoming a bit more of a trend, that people travel overseas for a few days for skincare treatments. Dr. Stephanie, do you think that people should avoid that to reduce complications?
Well, I'm not totally against traveling overseas. I can see some advantages. Number one, you get cost savings. Number two, sometimes you pair it with a travel, you enjoy, stay in the hotel and do some treatments at the same time. I think that's fine, but patients who do want to go overseas for treatment have to be cognizant of certain things. Number one, the credentials of the doctor. I think they have to do due diligence, to do their research, because the quality of doctors may range a huge deal overseas. Number two, the continuity of care. When you go overseas and you come back, if there's any issues or touchwood complications, it's not so easy to get a follow-up with that doctor. And it's not like in Singapore where you can call up the clinic and ask the questions and get your follow-up care. Number three, I think the legalities of things, for example, whether your insurance covers certain costs or, if something, again, is about this, something bad is to happen, the legal matters, again, would be a bit complicated. Yeah, and also the last point is communication, because sometimes when you're overseas, there's a language barrier. It's hard for the patient to tell the doctor what they really want, or for the doctor to understand the patient's expectations. So I think that's an important point for patients to consider if they're going overseas for treatment.
Absolutely, could not agree more. And it's not as simple as just looking at the reviews to see positive experience someone else had, because because it could have been that they had more downtime period in that country, or even they had a better experience in communicating with the doctors in said languages, in their respective languages, in whichever country that they visit.
And I think to add on to that, when a complication does happen, especially relating to injectable, and you're overseas, then there's the issue of really, do you want to stay back in the country? Then, you really have to spend time there, versus if you do an injectable in your own home country, whereby when a complication arises, it's easy for you to get back to the doctor to have the issues resolved.
Yes.
Besides what Dr. Stephanie has mentioned.
Yes, true. And plus, you'll have to call your office for extra off days. That's going to be a bit of a tricky situation. But okay, we're going to dive into HA dermal fillers and biostimulators specifically. We're going to ask Dr. Lam this question. Now, what are some of the most common complications that you see with fillers, and how can patients recognize them early?
Now, dermal filler complications can range from mild and temporary to very serious, although very rare, vision-threatening complications. That's very, very rare. Common complications will include bruising. As Dr. Ha has shared, bruising is a given because they're using a cannula or a sharp needle. It can be swelling, redness, sometimes unevenness, or lumps and bumps after injection because it's injected at the wrong layer and wrong plane. How do I tell patients after injection to recognize these signs? I always tell patients, very simply put, when you do dermal filler injections, during and after injection, you're not supposed to experience any severe pain. That's number one. Number two, make sure the skin doesn't turn red. When it's red, it may mean infection. It turns white, it might mean that your injector has injected the filler into vessels, blocking the vessels and blocking the blood flow to the area. Or the skin shouldn't be too blue, which means that you have a hematoma, or in other words, a very bad bruising. So when all these happen and you're not sure, pick up the phone, call your trusted injector, and then relate the symptoms to your trusted injector. And that goes back to the same points. If you've done it in your local country, in Malaysia or in Singapore where your doctor is, you pick up the phone, there's a complication, you just go back to the clinic. But if you do the injection in another country, in the USA, in Korea, and you're in Singapore and Malaysia, then you have a problem. You have to get someone else to manage the complication. And that's the reason why I agree with Dr. Stephanie that when you want to go overseas for an injection, it is best to think through all the various factors before you take that step and embark on that treatment.
Absolutely. Now, when it comes to that, let's hope that it doesn't happen, of course. But should there be any instances where there's like a complication like lumps or unevenness after a filler treatment, what should a patient expect to happen? What the doctor would do to help solve the situation?
Trust me, when there's a lump or unevenness, even if it's a patient's own muscles, the patient will definitely pick up the phone and call us and call me and say, look, doc, there's a lump on my face. So generally, if a lump or unevenness happen, please go back to your injector. Don't see another doctor, because sometimes you don't know whether you already had a lump before that or it is caused by the injector injecting the product onto your face. So go back to your original injector, your trusted injector, get the issues resolved. Now, if the unevenness or lump is due to overcorrection, or putting the product in the wrong place and wrong plane, if it is a HA dermal filler, you can actually dissolve it with an enzyme called hyaluronidase. So the issue is solved quite easily. So I think to answer your question, if you have a complication, please go back to your original trusted injector. You go to him or her because you trust him. So you should actually bring back the problem so that the problem can be resolved.
Understood. Thank you so much, Dr. Lam. Now, I'm going to look into skin boosters and collagen stimulators, but I'm going to ask this question. As injection goes, you might have certain instances like where things may go wrong with skin booster injections, like the risks of allergic reactions or long-lasting bumps. But how do you minimize the risk of complications for your patients?
So, how do I personally, as a doctor, minimize those risks? Number one, I feel that I have to do my due diligence in checking the products. So I have a personal motto, and this is very personal to me. I do not use any product that I would not use for myself or my family members, right? So because, again, we receive information from the manufacturer, from the distributor, right? And we have to trust that information. And we as a doctor, we are trained to analyze, be critical of the question that we ask them, right? And only after we have done a very in-depth study about a particular product, the study, the safety profile manufacturer have performed on that product, and then we trust that particular product, right? Then we know that it is safe to be injected to the skin. And next, once we have the correct product, the right and the safe product, then we have to think, what is the way to deliver a particular product safely? Because if you deliver to the wrong layer of the skin, then that also may contribute to issues that creates lumps and bumps or even allergic reaction. So then I have to think of ways to deliver the product safely, and with the right product, with the right ways of delivering the product, this is how I can minimize the risk.
That's very, very good to know for a patient as well, because I think as a patient, if I were to visit my doctor, for example, I'd like to be able to maybe, I don't know, is it appropriate for me to ask, so doctor, have you used it for yourself? Actually, could I ask you that question if I wanted to?
Yes, definitely. And the thing is, I might not use all the product on my face, but I would be very clear to you. Look, my wife have used it,
Okay.
for these certain products. My mom have used it for these certain products, because why? It's just that I don't need it at that moment.
True.
Right? So yeah.
Good to know, good to know. And so with that being said, after obviously really thoroughly having a conversation with a doctor and whatnot, and sometimes allergies don't pop up immediately. It will come up a little bit later. So what should patients do if they notice something unusual? Like perhaps give a sort of like an example. If I were to go for a treatment, let's say, what it would be considered as something that is worrying for me, like for me to actually to call you back again.
Well, when you do any aesthetic treatment from a doctor, I believe that the doctor has the duty to explain to the patient what is to expect after the treatment, right? And one key point is this: if you have any worries at all, if you think something might not be going the right way, the right direction, just pick up the phone, call the clinic, speak to the doctor or the staff, and get help quick. This is the reason why it's important to do the treatment locally, because you can just visit the clinic, get it checked, and if the doctor said, don't worry, no issue, you can just go home and rest. It's a normal process of healing, and it's fine. But if you go to the clinic and doctor said, okay, this might be something more severe, we have to act now, then at least you are covered and we can minimize further complications from that.
That's very true. And you should not be afraid of your doctors. They're not disciplined teachers. They won't get mad at you if something were to happen. But of course, if you don't follow the regime that they ask you to, then that might be a different story altogether.
Anywhere on the face is risky if you're worried about, going severe complications.
There are people that's getting it from just Shopee.
Even if a complication does arise in botulinum toxin injections, they will all be resolved in 4 to 6 months.
We doctors are given the privilege to inject, not because we know how to inject, but because we know when not to inject.
I think that's something else, like a really red flag for you.